Thank you for coming. My name is Megan Fry, and I'm a 19 years old college student at University of Houston, and I have cerebral palsy. I tell people, it's just a wiring problem that connects my muscles to my brain, which means I couldn't talk by myself. I use this computer called a Microsoft Surface with an eye gaze to communicate. There's a camera at the bottom that picks up my retina in my eye, and when I look at a button and blink, it clicks just like a computer mouse. Since the Surface is a regular window-based computer, there's a language software on this device that lets me talk like a regular person. Also, on this device, I can text, email, internet, art, work at school, and everything. As you can see, I came without parents. Well, that was on purpose. 1. I wanted to give you a glimpse of my world now, as a young adult, and how I handle having cerebral palsy both physically and emotionally while living independent. And 2. I didn't want Mom to take over the conversation. Ha ha ha. You are all here today because you want the best for your children. Well, in my opinion, you are at the right place. You are probably scared about the unknown. We know this cues we were scared too. But my parents kept focus on what would be the best treatments to ensure I would have all the long-term opportunities to be empowered and enjoy life. So, it's okay to be scared. But I speak for your children, please don't let those fears keep you from seeing the future they can have. A future that has endless possibility. The treatments and procedures you learn about today have made it possible for me to have a wonderful life full of adventure and independence. I am now a freshman, living on campus at the University of Houston. Go Coags! Though it's not without its challenges, college has been great. I especially enjoy learning how to live on my own. Today, you are going to learn about the latest treatments and surgeries to help manage the challenges of cerebral palsy. Tight high-tone muscles and loose low-tone muscles. These procedures and surgeries are very common to a large population of kids with cerebral palsy. And these rock star doctors will guide you through the steps of the procedures. I had many of these surgeries and will be here to help with the behind-the-scene knowledge, like prep and post-procedure hiccups. What I can tell you now is that I would not be able to be sitting upright, talking to you, if these procedures were not done. So ask yourself, if you were the one with cerebral palsy, what would you want your life to be like? Post-surgery is tough. Probably more tough for parents than the patient. You are our advocate. You are our voice, and you know us best. We also know you are a dead dog, tired, stressed out, and hungry. This in turn brings out less than pleasant personality traits. I have seen this firsthand with my mother. But also know that the nurses have lots of patients at once, so when they ask for something that doesn't make sense, or is unreasonable in your mind, don't be offended. They are following protocol and procedure. As my mom always says, treat others as you would like to be treated. Kindness always wins. For both parties. Also, be prepared to stay with your kid the entire hospital stay. Maybe take shifts with other family members. You never know when the doctors will be coming to check in, and you don't want to miss any update. Keep notes daily. Often you are in hospital for a few days, and sometimes a week after surgery. The days tend to run together, so take notes. Keep log of progress or setbacks. Also, the hospital does not bring a separate food tray for the parents or caregiver. So bring your own hour. Do what Mom did, and just check off a few extra boxes on the patient menu. Ooh, and I used to hate when nurses would turn on all the lights in the middle of the night just to take vitals. Really? Bring a flashlight and ask them to use it if they don't have their own. And finally, try and sleep when your kid sleeps, even during the day. Lots of noise keeps you up, unless you're the patient and have good drugs. Laugh out loud. When I was 5, my doctors told my parents that a baclofen pump was going to really help my stiff muscles. Baclofen is the medicine, and it goes directly into the spine. Crazy cues if you take the medicine orally, then it can affect your mind. The problem was, I was not big enough to put the device inside me. I guess the only place it can go is under ribs and above the pelvis. Anyway, we delayed till I grew enough. Before surgery, we went in for a trial. It took all day. They did an epidural to put the medicine in. I had to lay still for hours. And I don't think we're in a private room. When I had the actual surgery, I remember being really scared. And I remember really hating the smell of the sleepy gas. They gave flavors. Yuck. I also remember being scared when I woke up in the recovery room. I was all loopy feeling and nauseous. Recovery was okay, but I had to lay flat for a few days. Sitting up put pressure on the entry point into the spine. Don't sit up too fast. You get way sick. Trust me. When I was 13, I grew really fast. So fast that my low tone in my trunk could not hold my spine. It bent over to 82 degrees. OMG, it was crazy. I had to wear a full trunk brace for months to see if it would slow it down. But it didn't. Do y'all still do that? It was so uncomfortable and hot. It started to stink after a while. Anyway, surgery was intense, especially for Mom and Dad. It's like an 8-hour surgery. Recovery was rough. And funny, I remember the nurse coming in my room the day after surgery and asking me to get up and walking. Really? Not gonna happen. My mom told her to go call my doctor first. And she never came back again. Ha 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 advice. Really get personal with the anesthesiologist team. They are wonderful. I told them absolutely no gas, needle poured much better for me. And I needed nausea medicine right away. That really helped my anxiety, especially if I woke up before my parents got to the recovery room. I also had Botox many times. My hamstrings are so tight I couldn't straighten my legs. I also tried it in my biceps, hoping it would help with my arm control. I also recently tried it in my salivary glands. It was a temporary solution to see if turning off my spit would help with my drooling. I would have to say, really finding the care you need. Like me. I have to have 24/7 care. I have 5 employees. And being in charge of employees as young as 19 can be hard. You have to be good at advocating your needs. And, of course, you cannot feel bad if you have to fire somebody you are getting mistreated. I hire all of my employees by myself. And fire by myself. The main point is you have to be good with communication skills with people. Which most 19-years don't have those skills yet. I have to be the boss. So it's really hard. But so much better than living with my parents all of my life.